Hi everyone, I'm Dr. Tara Campbell, naturopathic doctor at Higher Health Center. And as we resume and refresh our commitment to our health routines, I wanted to highlight a very important nutrient that has so many health benefits in our body. 40% of people are actually deficient in this important nutrient. And so if that is you, you may be experiencing symptoms of fatigue, low energy, anxiety, or lower mood. You may even notice that colds linger and you might have body pain. So let's take a deep dive into vitamin D. Most people know of vitamin D's benefits for bone health. It helps in the absorption of calcium, magnesium, and phosphorus, which all really help to mineralize the bone, and that improves the structure of your bones, preventing osteopenia and osteoporosis. And that's really important as we age. We don't want to have any unnecessary breaks or weakened bones. Vitamin D is also very important for immune health. And interestingly to note, our white blood cells have vitamin D receptors on them. So think of vitamin D plugging into our white blood cells to benefit our immune system. Research actually shows that people who are low in vitamin D are more susceptible to cold and flu, and they also have a harder time recovering from cold or flu. So that's a really important thing to know right about now. Perhaps my favorite benefit of vitamin D is its role in mood and brain and hormone health. Many people know of seasonal affective disorder. This is in the fall months, September and October, when our exposure to sunlight decreases. And so we are less able to synthesize vitamin D from the sun. Then, if you have high melanin in your skin like myself, I have high melanin and darker skin. When I go outside, I tan very easily, but that makes it harder for me to absorb vitamin D. So I am personally more at risk for seasonal affective disorder because of A, the decreased light exposure in those months, but B, because of the high melanin in my skin. Also interesting to know is that vitamin D is important for helping to make important neurotransmitters like dopamine, adrenaline, noradrenaline, and serotonin. So that's very important for mood health, but also hormone health. Vitamin D has a role to play in making estrogen, progesterone, and even thyroid hormone. So we've covered bone health, brain health, hormone health, and immune health. Last for today is cardiovascular health. Similar to our white blood cells, our heart muscle has vitamin D receptors on it. And so vitamin D has an important role in cardiovascular health. Any clients of mine who have a family history of cardiovascular disease, or if they have high blood pressure or any heart-based concerns, I always want to assess vitamin D levels. How do you know if you're vitamin D deficient, aside from the symptoms mentioned earlier? The best way to do this is with a blood test. So I really want all of my clients to do a blood test for vitamin D, and levels, a normal range is between 75 to 250 nanomoles per liter. If you're close to 75 or below, I highly recommend increasing your vitamin D stores. Now, how do you increase your vitamin D? The simplest way is with supplementation. I usually recommend a liquid form, which means it's already emulsified. And because vitamin D is a fat-soluble vitamin, you can absorb more when you take it with a fat-based food. So healthy fat foods like avocado, nuts, olive oil, a lot of fish oils have vitamin D in them. And I like the liquid form because being already emulsified, it's broken down into smaller fat molecules, making it easier to absorb across the digestive lining. And if you're very low in vitamin D, please reach out to ask us about vitamin D injections. This is an easy way to get your stores up faster, and I would love to educate you on that. So when any questions come up about blood work for vitamin D or hormone or neurotransmitter-based symptoms that may be a result of vitamin D deficiency, please reach out. I always love reviewing and answering questions on myhealthcall.ca. Thanks, and have a really great day.